All right. Good afternoon, everybody. Back here with another video for you all, big one. And this is take two because someone forgot to press record this morning when trying to do take one. So let me make sure to share my screen. All right, there we go. So we're going to jump right into it. This will cover a lot of um, antibiotics, but it will also cover a little bit of reproduction in relation to pregnancy. So first, we're going to start with that. We're going to jump into first aid, repro, physiology under 3, and then we're going to go to pregnancy under physiology, and we're going to be in physiology here. And you want to activate most of the cards here. You want to skip the first 3, grab 4 and 5, skipping 6. Come down and you can grab the rest, and the 3 that we don't want is this card here, the oral contraceptives, and then these 2 down here talking about the timing of human chorionic gonadotropin hormone in this fertilization card. And then the other section we want here is the physiologic changes, and you want to grab all of those. And then that is it for the pregnancy section. And then we're going to go to section 10, the human placental lactinogen, and we're going to go into gestational diabetes. You want to come down to the bottom. You want to grab cards 2, 3, and 5 coming up from the bottom. And that is going to be it for the pregnancy reproduction. And then we're going to go up to microbiology and then into antimicrobials. And so this is going to be a lot of cards here. So we'll take it slow, make sure your sort field is oriented the same as mine. And I just want to preface this that most of the bacteria or the antibiotics we covered are in here, except for 3. There's the fosfomycin, cycloserine, and the methenamine. Those 3 were not covered, but there's luckily just like single one-page slides on the PowerPoints. But in addition, I'd recommend using Sketchy or some other resources to help you learn these. So we'll get right into it. So jumping into penicillin G and V, we want to grab the first 4 cards, skipping 5, getting 6 and 8. And then you're going to skip 4, grab this one here, talking about nafcillin, skipping 1, grabbing the next, talking about all of the penicillins causing a hypersensitivity reaction. Skip a good chunk until you get down to what gout drug can precipitate. So you want to grab that one and the next one, skip 2, grab the benzanthine, and then skip 3 and grab the next 4. And then leaving that last 4th one highlighted, we're going to scroll here and then have that highlighted one at the top of your screen. You're going to skip 2, and then you're going to grab the next 7 cards here. And then you're going to skip these 2 here, talking about penicillin G, the first 2 penicillin Gs. You're going to grab the second 2, as well as this 3rd one following it. And then you're going to skip the next 5 cards and grabbing this monobactums right in the middle of it. Skipping 2, getting this in patients with streptococcal infections, pick up that one. Skipping 3, grabbing this one. Skipping 3 and grabbing the next 2. And skipping 4, and these will be the last 2, so the 3rd and 4th from the bottom. And then this section, this is likely a lot of repeat in sections 3 and 4 here, penicillin sensitive and resistant penicillins. So we're going to move a little quicker. So you're going to just grab these 2 cards. If they should mostly already be activated. I think there's a couple that I added since. But skipping the first 6, you're going to grab 7, 8, skipping 3, this one, skipping 1, these 2. Skipping 5, you're going to grab this one, susceptibility to amoxicillin, what gout drug. And then you're going to come down all the way to spectrum of amoxicillin and ampicillin. With that highlighted, you're going to scroll down, skipping 2, grab this one, skipping 3, grabbing that one, skipping 4, grabbing these 2, skipping 3, these 2, skipping 1, and that odd one out. And then we're going to go to the resistance. And again, most of these I think should be activated, but you just want to make sure you have the first 4, skipping the 5th, grab 6, 7, skipping 8, grabbing 9, skipping 10 and 11, and then grabbing these 3, skipping this next one, and then out of all the rest, just all but the last one. So that is what your screen should look like. And then we're going to go to section 5, the anti-pseudomonal penicillins. So the first 3, skipping 4, then grabbing the next 4 cards, skipping this one here, and then picking up this bactericidal card. And then we're going to go to the cephalosporins. There's a lot of good ones here. So you want to grab from the first one all the way down to the route of administration card. All of those are good. And then you're going to skip 5 cards, grabbing these next 2, and then skipping 2 more, and then grabbing this next chunk here. I believe that's 8. Yeah, 8 cards. And then you're going to skip 2 here, the which third generation cephalosporin can treat that, and which beta-lactam. And then we're going to grab this, what structural feature of penicillins give their activity. And from there, we're going to scroll down until the highlighted one's at the top. We're going to grab the 2 below the highlighted. We're going to skip this first DOC, but grab the second. And then we're going to skip a good chunk until you get to what cephalosporin can bind the altered penicillin binding proteins. You're going to skip the next one, grab the next, and then skipping a big chunk again. You're going to come down to the last 3 that say non-gram positive COXY coverage and grab those 3. And we'll leave that last one highlighted and scroll down here, and you're going to skip the next 3, grab 2, skip 1, grab 1. And then we're going to jump to the bottom, and you don't want the last card, but you want the second and the third coming up from the bottom. And you want to skip this one, grab these 2, skipping 2, and grab these 2. And then we're going to go to beta-lactamase inhibitors, and you want the first 6. And then we're going to go into carbaminims. Yeah, you want the first 4, skipping 5, grabbing this one, skipping 1, grabbing 2, skipping 1, grabbing 2, skipping 3, grabbing these 2, skipping 2, grabbing these 2, and then you want the last 6 cards. Monobactams, you want the last, spent too much time on Sunday. Skipping 5, and then you want to grab the next 5, skipping 2, grabbing 1, skipping 2, grabbing 1, and then the last card there. And then vancomycin, a good amount here. So you don't want the first card, but then you want the next 7 cards. So the Enterococcus species VREs. So in second down, you just activate them like that. And then you want to skip the next 3 and grab this one, skip 1, grab this one, skip this one, and then grab the next 3, skip this, grab this one, and then skipping the next 4, and you grab these 2. Vancomycin is known and known, skipping 2, grabbing these 3 cards here. And then with that last one highlighted, we're going to scroll down, and you're going to grab this one up in the middle. Upon rapid infusion of vancomycin, it gets the that's the red man syndrome, or the vancomycin flush syndrome. But there's good visual images here for that. And then you're going to skip a whole bunch, and you're going to get down to how is vancomycin typically administered. It's through IV. And you're going to grab the one following that, and then you're going to skip 2, and then grab these next 3, but not the bottom one. And then you're going to get to protein synthesis inhibitors, and you can activate all of these if you want. They're all good. I just left this MOA1 blank just because it's a repeat concept in here. I think there's 2 cards activated in relation to it. And then we're going to go to aminoglycosides, and we want to activate the first big chunk here. So aminoglycoside all the way down to the end of the aminoglycosides before it says muddy brown. So all of those, and then down in the middle, you're going to get down to which antibiotic. So there's a whole section here. You want the last 2 of those cards. So which antibiotic is misreading mRNA and then binds the 30S ribosomal subunit. And then from there, you're going to scroll down, and actually we'll leave the highlighted one at the top. And then with the highlighted one at the top, you're going to read down until you get to what is the coverage of aminoglycosides. And you want the one following it. And then you're going to skip a big chunk until you get to this card here, quinupristin. Yeah, this one. Just look for that 50S right there. And that's the one you want. And then we're going to leave that one highlighted and scroll all the way to the bottom. And then starting from the bottom, we want the third one up. And then you're going to skip, I believe, 6 cards. Grab this other one that says 30S ribosomal in it. And then keep coming up until you see causes misreading of the mRNA inhibiting translation and thus protein synthesis. And then we're going to go to tetracyclines, and you want the second, third, fourth, and fifth. And then we're going to skip a big chunk here until you get to which bacteria are susceptible. And you want that one and the next 2 following it. So the chunk of 3. Then you're going to skip 3, grab that next one, skip 1, grab that next card, skip 2, grab the next one, skip 1, and then you're going to grab this chunk of 6 cards here to remember the protein synthesis. And they're going to leave that last one highlighted. And then you want, I guess, there's 7 that say to remember the protein synthesis. Just grab the first 6. The last one's not super helpful. So that card, then you're going to skip 2 and grab these 3 on tetracyclines. Then you're going to skip 3 tetracyclines, grab these 2 here. So she'd have a 2, 3, 3, and then 2. And then you're going to skip 4, grab this one that they're bacteriostatic, skip 2, grab this one. And then down right in the middle, the irreversible inhibition of growth, bactericidal is the one you want. And then tigecycline, if I said that right, all of them except for this middle card. This is the ones you want. Chloraphenicol, that word. You want discard 3, 4, 5, and 6. And then you're going to skip 3, grab this one, skip 3, grab this one. And then you want to come down to, it says chloramphenicol prevents peptidyl bond formation. That one, and then the second to the bottom. Clindamycin, you want the second one, and then the 5th, and then you're going to skip 2 and grab the next 3, skip 1, grab this one, skip 5, grabbing this card, skipping 2, grabbing this one, skipping 3, grabbing these 2 here. 17 linezolid, you want the first 7 cards, skipping the 8th, grabbing 9 and 10, skipping a chunk of 4, grabbing that one, skipping 3, grabbing those 2, and then the second from the bottom. Macrolides, you want to come down until you see which step A through E. That's the first card you want. You're going to skip 1 after that and grab the CYP450, and then you're going to skip 5 cards, grabbing this 23S RNA card. Then you're going to skip 3 more, getting to what suffix is associated with macrolides. Skip 3 more and grab this one. What is the class of antimicrobials? Or what is the group? Yeah, name of that. And then with that one highlighted, we're going to scroll to the bottom, almost to the bottom, I should say, leaving that highlighted one at the top, just so I don't lose you here. You're going to skip a whole bunch of cards until you get down to the first macrolides prevents translocation by the binding. That's the one you want. You're going to skip 4, grab the next 3. And then we're going to scroll all the way to the bottom here. And there's none below these next 3. So you're going to skip 7 cards, getting to these last 3 macrolides cards. So there's a whole bunch of macrolides here in the order. You just want those last 3 out of that. And that is it for this section. Then the polymyxins. You want the 5 coming up from the bottom except the last card. So that chunk of 5 there. Sulfonamides, you want cards 4 and 5, and then you're going to skip a big chunk until you're going to get to this TMP-SMX right here. You want that one, and then you're going to skip a big chunk, grabbing this card here. That trimethoprim is often combined with sulfamethicillin, that word. Skip 1, grab these next 2, skip 2, grab this card here. And with that, we're going to highlight that. And I'm showing you that there's no more here. There's a lot of fluff for now. All right, so that's section 20, and then we're going to move to 23. So we did 2 through 20 all in a row, and then we're going to skip over 21 and 22 and go into 23. Within 23, you want the first 2, skipping the 3rd, grabbing the 4th, skipping 5 and 6, grabbing 7, skipping 8, and then grabbing the next 4. And then you're going to skip 3 and grab this one here. What is the suffix of oxycin as the suffix in fluoroquinolones? And then you're going to skip 4, grab the next 2, skip the next 6, I believe, 7 or 6, until you get to some fluoroquinolones can prolong the QT interval. And then we're going to scroll, and there's just 2 left you want. So if you follow it down, just look for the nucleic acid synthesis inhibitors card. That's the one you want. And then the one at the very bottom. And then we're going to get to daptomycin. And in daptomycin, you want the first 2, skipping 4, grabbing these next 2, skipping 1, grabbing these next 2, skipping this one, grabbing this one, skipping this one. And then you want to grab this next chunk of 6. So that chunk of 6 right there. Polymyxins down to daptomycin is bactericidal. And then you want the last 2 cards. And then metronidazole, you want most of these. And so you can grab this first big chunk if you want, or you can just activate the whole thing and then deactivate this one here in the middle, which is a first-line treatment of intra-abdominal anaerobic infections. Don't want that one, it wasn't said specifically. And you don't want the last two. And then you want to skip this one because we do want this one, and then deactivate those three there. All right, then we got rifamycins, and you want the first two, skipping 3 and 4, grabbing 5, 6, and 7. And then from there, you're going to just go to the read here until you get down to rifampin. And you're going to read through rifampin until you get to the last 3 rifampins, and you want those last 3. And then we'll leave that one highlighted, and we're going to scroll down. Just actually, you can see the last card from the top. You're going to skip the next 6 cards to get to is rifampin / rifabutin. You want that one. All right. And then that's going to bring us almost to a close. So we're going to scroll down to the second section 34, the other antibiotics. And I just want to show you there's none in clofazimine because we didn't learn about that. But fidaxomicin, you want the first 2. Mupirocin, there's 1, pick it up. And nitrofurantoin, the only good one was the one right in the middle, card number 4. And that is going to bring our video to an end. So hopefully this was a little faster than my initial take that I forgot to record, but hope this helpful. Take it slow, pause it, rewatch it if you need to, and happy studying.